Hi, and welcome to Chapter 7, where we will review safety. In this chapter, we're going to focus on safety both in the radiology department and the hospital setting. In 2006, the Institute for Healthcare Improvement launched a campaign that was aimed to save over 100,000 lives by reducing fatalities in the healthcare institution. There were 3,100 hospitals that participated in this initiative. Some of the goals and the steps to reach those goals that were established by the 2019 National Patient Safety Goals for Hospitals were to identify patients correctly. So by using your patient's name and date of birth to ensure that the correct medicine and treatment were completed. Improve staff communications to get the test results to the correct person. Use of medicine safety, use of alarms safely, preventing infection, identifying patient safety risk, especially those that were at risk for suicide, preventing mistakes in surgery. So in our case for radiology, one of the most important things that we can do is label our films correctly. And we identified that in class the other day where we were talking about the importance of putting the right marker on the right side or the left marker on the left side, because you don't want a person to go into surgery and have the incorrect body part removed. So when we're looking at patient safety as a whole, radiology does have an important role in that aspect. There were 5 recommendations that were established by the Institute of Healthcare Improvements, and that was deploying rapid response teams, delivering reliable evidence-based care for acute myocardial infarction, which is your heart attacks, preventing adverse drug events, preventing central line infections, preventing surgical site infections, and preventing ventilator-associated pneumonia. Now you look at that list and you think, how does that relate to me in radiology? Well, one of the things that we do is we do administer drugs. And in that situation, we're giving them contrast media. Sometimes we're giving them lidocaine injections. And so we want to be aware of what the effects of that administration of those contrast media or lidocaine or anything else that you may be giving your patient does to your patient. So there is a pharmacology course that you will be taking that will tell you about what those drugs are and what are some signs and symptoms that you need to look for in case there is an adverse drug event that takes place. So throughout this chapter, we're going to talk a lot about safety in regards to the patient, in regards to you. So the first thing that we're going to talk about is fire safety. And this is one of the things that OSHA, so most of you that have worked in any place of business are familiar with OSHA. OSHA is the Occupational Safety and Health Administration. It's a federal agency that governs rules about safety in the workplace. So they set up guidelines and they establish guidelines and they require mandatory testing for these guidelines each year. So your workers, as part of the hospital system, will still have to go through training, including fire safety, when you are out there as a radiographer. So when we look at fire prevention, we need to be aware of potential hazards. The fire requires oxygen, fuel, and heat, so we need to be cautious of the surroundings. So most hospital fires are going to be caused by spontaneous combustion, open flames, cigarette smokers, and electricity. Oxygen supports combustion, and guess what we have in our rooms? When we bring our patients into our rooms, they may come down with an oxygen tank. And you also have oxygen that's in the wall that you will hook the tubing up to. So you do need to have extreme care when you're using these devices and know how to shut off those valves correctly. Your wall outlet is going to look something like this, and you'll see there's a knob that you turn on and off. And your patient's going to arrive in the department and they may have this type of oxygen mask. So here's a full oxygen mask and this is a nasal cannula. You may go into an ICU room, which is a patient who's in an intensive critical care unit. And they are going to have more tubes and they're going to have more oxygen. So this is a ventilator that's hooked up to this patient. There is a video that I would like you to view. You have the option of you can stop and exit out of this and go back into the site to watch about oxygen administration. I encourage you to do that because I do track that you've watched the videos, and then you'll receive credit. So you can stop the video here, go and watch the oxygen administration, and then resume playing of this video. Or you can wait till the end of this video and go and watch these videos that I have linked you to. With fire alarms, you need to know your fire plan for your facility, know how to evacuate in case of a fire, and you need to locate fire alarms, extinguishers, and fire doors. Keep in mind that with your patients, if there's a fire, you don't want to put them in an elevator. So you do need to know an evacuation route that's going to be safe for your patient in the situation of a fire where you can't use the elevator. So when you go to your internship, one of the things that you'll want to pay attention to, and I'm sure they'll talk about during orientation, is how do I evacuate myself and my patient safely? In case of a fire, there is an acronym that's used called RACE. It stands for Rescue, Alarm, Contain, and Extinguish. There is another acronym that's called PASS, where you pull the fire extinguisher. So you pull the pin, aim, squeeze, and sweep. So a fire extinguisher is going to look something like this. That will be available in all of the departments. You will pull your pen, breaking your seal, aim your nozzle, squeeze your handle, and then you're going to sweep at the base of the fire. I do have 2 videos linked for you to watch, one in regards to RACE, another one in regards to PASS. Again, you may stop the video at this time and go view those videos and then pick up after that point, or you can wait till the end of this presentation to go and view those videos. The one thing to keep in mind with your fire extinguishers that the videos are going to talk about are the different classes assigned to a fire extinguisher for that particular fire. So if you have an electrical fire, you want to make sure that that class matches up with that particular. So if it's a open flame, that's okay. You can use your regular fire extinguishers, but in some situations where there are chemicals being used, there are certain types of fire extinguishers that need to have a certain classification that you need to grab. Those videos that I have you watching are going to go through and they're going to explain those different types and what those mean. Now let's take a look at common hazards. With common hazards, we have electrical safety rules, and in here you need to be aware of your electrical equipment and appliances. They must be approved for hospital use. You need to follow your equipment manufacturer's instructions. Equipment must be used or near patients or near water, must have grounded plugs. And you must inspect equipment regularly, paying attention to the cords and plugs, and arrange for repairs that are needed. So what you saw when we were talking about the lawsuits that can occur, one of the things that you want to pay attention to when you're going into a room is if there is a frayed plug, so that it's exposed wires, you do need to put in a work order to have that fixed, because the last thing you want to do is get dragged into a lawsuit if a fire occurs and you are aware of something that was damaged in those rooms. So bring that to your supervisor's attention. If you walk into a room and there's water on the floor, you need to get someone in there to help clean up that water so that someone doesn't slip and fall. And if you're near an electrical plug, you're certainly going to want to watch to make sure that nobody walks in and becomes electrocuted. We did have a situation in an x-ray room one time where it rained very heavily and water flooded into our room. And so when you walked into the room, there was about 3 inches of water on the floor. You didn't see that from the hallway until you walked into the room, and the room backed up to a hill on the wall side, and that's where the water was running through. So those are things that you need to look for when you're walking into a room. I also had another situation where the x-ray tube did catch on fire, and there was smoke coming out of the x-ray tube, and so you needed to immediately shut off all of the electricity that's going into that room. So be aware of where that on and off switch is in the circuit breaker so that you can turn off the power to those rooms in a situation where there's a fire that takes place or if there's water on the floor. You don't want to overload your circuits, so connecting too many devices to a single outlet overloads and you can cause an electrical fire. Unplug or turn off electrical equipment before exposing internal parts. Do not attempt to repair equipment, especially in the hospitals. You do have people that work for maintenance and they will come and take care of that. You can only use extension cords if they've been approved, and in our field and in our department, we don't use extension cords. And then the one thing that I want you to remember is the letter C. So remember I was talking about when you watch that video, they'll talk about the different classes for fire extinguishers. If it's an electrical fire, you need to use a class C, which is a carbon dioxide fire extinguisher. Okay, so now when we're talking about falls and collisions, there are a few things that can occur. We need to take precautions for our safety of our patients, but we don't want to hurt ourselves. And we don't want to park equipment near corners. We don't want to store heavy items on upper shelves where things can fall on us. We don't want to stack and store those items. And we don't want to string electrical cords across doorways where people can trip over them. There are also times where there might be chemical spills. This is where those material safety data sheets come into play. So with MSDS sheets, they will be available in every department. So anytime you have any chemicals, they are required by law to have an MSDS sheet. So your MSDS sheets will tell you what to do in event of a chemical spill. And it will explicitly tell you, here's the steps that you need to take with this particular hazardous material. So ask for your MSDS sheets, which have now changed their name, and they're called safety data sheets. So the MSDS term is outdated by about 5 years, but institutions are still referring to them as MSDS sheets. And your book still has it listed as MSDS sheets. So just be aware if you're looking for the MSDS sheet, it's probably going to have safety data sheet at the top and not material safety data sheet. This is an example of what one of those would look like. And so they do have an example online. If you looked up material safety data sheets or safety data sheets, you'll see something that looks like this, and it will literally walk you through what you need to be aware of for that particular material that you're trying to clean up, that waste. If you do have an eye splash, departments are required to have an eye splash station, and you do want to treat that promptly. So if it's especially a chemical splash, you want to run water for a full 5 minutes on that eye, and then you do need to fill out an incident report, and you do need to have that treated so that you don't lose your eyesight. So make sure that you're aware of where are those eye splash stations at in your department in case, even if it's blood or bodily fluid that gets splashed up into your eyes. You want to be aware of where can I find some place to wash that out of my eye. So this is an example of an eye wash station. And this is an example of a shower that's used to remove chemicals from a person. And you may have eye wash stations that look like this. These are little bottles that you pull out and you just press on top, and a stream of water will flow out of that eye wash station. Okay, now the second half of this chapter talks about workplace safety. So in this section is where you get into the ergonomics. So this is how we move our body safely in regards to that working environment so that we don't injure ourselves or a patient. So our rules of body mechanics is that you must provide a broad base of support. You need to work at a comfortable height. When lifting, bend your knees or back straight. Keep your load well balanced and close to your body. And you want to roll or push a heavy object instead of pulling or lifting. One of the things that we'll start to teach you in lab is how to properly pull your patient across the table onto the table so that you don't hurt yourself. There are devices that I'll show you that help when pulling your patients. And so we want to learn how to do those correctly so that we don't end up injuring our back. When I talk about working at a comfortable height, some of you have already heard me say raise your table or bring your tube down to a working height. When you work at a more comfortable height, it reduces less strain on your shoulders so that you don't end up with shoulder problems later on. So with body mechanics for us, we do have a lot of patients that we need to lift. You will be dealing with patients that could be anywhere from 10 pounds up to 600 pounds that you're trying to transfer onto your table. They may come in a wheelchair, they may be walking but need assist. They may come on a stretcher. And so one of the things that we need to do is safely move them when transferring them. So we do need to apply our proper body mechanics when lifting and transferring so that we don't hurt ourselves. So one of the things down here, radiologic imaging professionals who use proper transfer techniques can reduce their injuries and minimize low back pain. And that's the goal of this chapter. So at work, typically if you had a desk job or as a student, this would be you sitting at your keyboard and you are operating at an ergonomical height, but this isn't reality for us when we are out in the field. For us, our stations will be tabletop, so you'll be standing, and then you'll have a keyboard and a monitor that are on that stand or countertop. So we're always standing and doing our paperwork, which is better for our back. So we're going to look something more like this. You will see some departments have chairs, but for the most part, when we do our paperwork, we're just going to come over to the table that's up at a reasonable height, and we're going to work from there. I do have some videos that I would like you to watch on body mechanics because sometimes that visual of how to do those movements is better than just me explaining it. So you're going to take a look at that body mechanics video so that you can see how to correctly move, lift, and carry. We have the sandbags. You've seen those phantoms that we use in our department. So when you get out there, there are some heavier devices that you'll be moving and lifting in addition to having to transfer your patient. So one of the big things that I want to emphasize is your base of support. So even if you're just lifting up a sandbag, if you are getting ready to transfer your patient, you need to have that wide stance that's going to improve your base of support. So your base of support should always be feet apart to increase the base of support for stability, and try to avoid standing on any tiptoes when you're moving. If you're having to stand on your tiptoes, you probably don't have a good base of support. Your center of gravity, you need to concentrate and make sure that you're always standing up nice and tall so that when you move, you have an easier way of twisting and turning. You want to hold any heavy objects close to your center of gravity. You want to make sure that you have good posture. Always keep your body lined and balanced. Hold that object close to your body. Bend with your knees, not your back. And don't twist your trunk. And then just remember to push rather than pull when possible. So here's some examples that came from your book showing you your center of gravity and how you should stand. I do think the video that I have posted for you does a much better explanation than the pictures in your book. So that's why I have them posted and are telling you need to view those. So take a look at your book in regards to that and learn those proper lifting principles so that you can keep yourself safe when you're out there. So under here, you'll see where it talks about all of the videos that I want you to view. So these are your videos for Chapter 12. And for Chapter 7, you're going to take a look at those. And then you'll get credit for your assignments for watching those videos for this week. Thank you, and have a great week.